The prevalence of myopia, or short-sightedness, is reaching epidemic proportions across the world. A recent study projected that by the year 2050, half the world's population will be short-sighted. Alarmingly, close to 1 billion people will be in the high myopia category, placing them at a greater risk of potentially sight-threatening conditions. Comprehensive eye care services will be needed to manage and prevent people becoming highly myopic, especially young children. To measure myopia in a patient, a refraction is performed. However, young children typically find it difficult to maintain a correct focus during this procedure, often leading to unreliable and inaccurate results. To counter this limitation, a drug is administered to prevent the child from focusing on close objects. This is known as cycloplegic refraction and is currently the gold standard for determining the prescription of treatment required. A recent study involving 6,000 Chinese children has demonstrated that existing autorefractor technology, when used without cycloplegia, results in more myopic results, with a greater difference found in younger children. Reliance on this technology alone may lead to misdiagnosis of the refractive error of the eye, resulting in an erroneous prescription. However, in many countries, only a relatively small number of practitioners are qualified to conduct this procedure. Additionally, in some countries, only medical doctors are permitted to use these drugs, and in many of those locations, medical doctors are few. The cycloplegic drugs can also take up to 30 minutes to take effect, meaning it is less suitable when screening large numbers of people. In contrast, a non-cycloplegic autorefraction can take only a few seconds. There are also side effects associated with cycloplegic drugs, including blurred vision for up to 1 day. While numerous efforts have been made with alternative technologies such as mobile phones, none of these are addressing the cycloplegic challenge and will not address the issue of accurate prescriptions in children. Brian Holden Vision Institute will build an autorefractor which does not require these drugs. By integrating the principles of cycloplegic refraction to relax the accommodation of the eye with existing technology, we can design a non-cycloplegic autorefractor. The result will be a faster procedure that can be carried out by a non-specialist in any community vision screening project before the measurements are interpreted and managed by practitioners. A truly non-cycloplegic autorefractor would be a major benefit in the several 100,000 optical practices and vision care centers globally and help to meet the myopia challenge across the world.